Hello, this is a continuation of our introduction to the concept of perfusion. The cardiovascular system consists of the heart and the blood vessels, the arteries, the veins, and the capillaries. It delivers oxygen and nutrients to the tissues and carries waste products to the organs responsible for elimination. The arteries carry blood from the heart to the rest of the body, and the veins carry blood back to the heart. As I'm sure you're all aware, that arterial blood carries oxygen and nourishment to the tissues. But the one exception is the pulmonary artery, which conveys oxygen-depleted blood from the heart to the lungs for oxygenation and removal of excess carbon dioxide. In general, the veins will carry deoxygenated blood, but there is one exception, and that is the pulmonary vein. In this slide, we're going to review about the arteries, the anatomy of the arteries. Arteries are muscular, elastic tubes that transport blood under the pressure of the heart's pumping action, which can be felt as the pulse. The pulse is what we assess as nurses. Large arteries branch off of the aorta and give rise to smaller arteries down to the thread-like arterioles, which branch into capillaries. An artery's wall, or inner layer, is called the tunica intima, and it consists of an endothelial or cellular lining, a fine connective tissue network, and a layer of elastic fibers. The middle layer, called the tunica media, is mostly smooth muscle cells. The outer layer, the tunica externa, contains supportive collagen fibers. Now, those elastic tissues resist distension and propel the blood forward and maintains high pressures that we see in the arterial system. The smooth muscle is able to constrict and dilate, and that is affected by the autonomic nervous system. So I want you to realize that the blood flow is directly related to the amount of constriction. When the vessel constricts and the lumen narrows, blood pressures go up. And just the opposite. When the smooth muscles dilate, the lumen diameter increases and blood pressures go down. The capillaries. They're the smallest and most numerous of the blood vessels. From the connection between the vessels that carry blood away from the heart, which are the arteries, and the vessels that return blood to the heart or the veins. That's what the capillaries are. They form that connection between those vessels. The primary function of capillaries is the exchange of materials between the blood and tissue cells. Capillary distribution varies with the metabolic activity of body tissues. Tissues such as skeletal muscle, liver, and kidney have extensive capillary networks because they are metabolically active and require an abundant supply of oxygen and nutrients. Other tissues, such as connective tissue, have a less abundant supply of capillaries. What I want you to see in this picture is that the capillaries are a single cell thick. Okay, and that is well demonstrated in this picture. As well, you will see that there are pores in between the junctions of those cells that make up the capillaries. That is important because later we're going to talk about how the plasma fluid leaks out into the tissues. And when there is a gap between those cells, then plasma fluid can leak into the tissues. Remember the term third spacing. Third spacing refers to a fluid that is anywhere where it is not supposed to be. Normally, plasma fluid should be inside the capillaries. But if it gets through the capillary pores and leaks out into the tissues, then we're going to have edema as a result, or worse, and we'll see how that can change and decrease the actual volume within the blood. Okay, so I want you to see that there is a gap in between those cells that make up the capillaries. Sometimes that gap widens, and we call it increased capillary permeability. So that's a term that we will be coming back to, increased capillary permeability. The walls of the veins have the same 3 layers as the arteries. Although all the layers are present, there is less smooth muscle and connective tissue. This makes the walls of the veins thinner than those of arteries, which is related to the fact that blood in the veins has less pressure than in the arteries. We've already mentioned this before, but remember the arterial system is a high pressure system and the venous system is a low pressure system. Because the walls of the veins are thinner and less rigid than arteries, veins can hold more blood. Almost 70% of total blood volume is in the veins at any given time. Medium and large veins have venous valves, similar to the semilunar valves associated with the heart, that keeps and helps keep the blood flowing toward the heart. Venous valves are especially important in the arms and legs where they prevent the backflow of blood in response to the pull of gravity. Okay, so blood moves back to the heart. Remember, this is very important with the concept of perfusion. We need to have the blood return to the right side of the heart. It does it through systolic pressures. Okay, the systolic pressure. Blood pressure helps to move the blood back to the heart. Certainly it does. And then we mentioned as well that the large muscles, especially the quadriceps, applies pressure and is exerted by those muscles to move the blood back to the right side of the heart. And then there is also, again, but we haven't mentioned it, there is a pressure within the thoracic cavity and abdomen. These are smaller pressures, but they also help to pull the blood back upward toward the right side of the heart. The arterial or supply side of the circulation has relatively high pressures created by the thick elastic walls of the arteries and arterioles. The venous or return side of the system, on the other hand, is a low pressure system of thin-walled distensible veins. Blood flows through the capillaries linking these two systems from the higher pressure arterial side to the lower pressure venous side. So I have a question for you. Which part of the peripheral vascular system, as you see demonstrated in this picture, has the major control of blood pressure? Well, I hope you're thinking arterioles. In fact, the arterioles exert the major control over arterial blood pressure. Okay? The structure of the arteries, veins, and capillaries. Capillaries are composed of only a fine tunica intima. Notice that the tunica media is thicker in arteries than in veins. The smaller arterioles are less elastic than arteries, but contain more smooth muscle, and this promotes their constriction and dilation. So yes, indeed, arterioles exert the major control over arterial blood pressure. Yesterday, we talked about afterload in terms of the resistance that the left ventricle must overcome in order to propel the blood forward. We also said that high blood pressures contribute to increasing the afterload. In other words, the left ventricle has to overcome more resistance when a patient has high blood pressure. So let's talk about what is blood pressure and what is high blood pressure. It is not equal to afterload. Okay, it is just one factor that can contribute to increased afterload. So pressure differences within the system allow blood to move forward. The amount of pressure in any portion of the vascular system is affected by blood volume, vascular resistance, and cardiac output. Okay? So again, I'll repeat that. The amount of pressure in any portion of the vascular system is affected by blood volume, vascular resistance, and cardiac output. It is the pressure differences within the system that allow blood to move forward. Peripheral vascular resistance is determined by blood viscosity, the thickness of the blood, the length of the vessel, and the diameter of the vessel. In this picture, you'll see that blood pressure is the outward pressure of blood against blood vessel walls. And that is represented by those first red arrows. Okay. And we also see in this picture another set of red arrows, which is demonstrating the vessel resistance. So when we talk about vessel or vascular resistance, we're talking about that inward pressure from the walls of the vessel. But blood pressure is the first set of red arrows, which is pushing outward onto the vessel walls. Okay, so that is what blood pressure is. All right. Now, there are lots of factors that affect a person's blood pressure. Yesterday, we said it's a normal occurrence as we age. There are age-related changes that occur with our blood pressure. And we said that as we get older, a lot of times the vessels become stiffer, and that will increase our the peripheral vascular resistance, the vascular resistance as those vessels harden, and then that will cause higher blood pressures in general. Of course, this is not across the board for everybody, but in general, as we age, our blood pressure will go up. Other things that can affect blood pressure: exercise. Exercise actually will result in our blood pressure going up when we exercise. Okay. Stress causes an elevation in blood pressure. We especially see emotional increases in our diastolic blood pressure more so than systolic. But stress can cause your blood pressure to rise. And we do see hereditary genetic differences in blood pressure, and those are based on race and gender. We also have medications can affect your blood pressure, and that is what we see in the picture below, where we have a list of medications that we're going to be talking about this semester that are antihypertensives, meaning that they can lower blood pressures. We'll go into a lot more detail about these different classifications of antihypertensive medications that will lower blood pressure. Our beta blockers end in the suffix OLOL, such as betalol, metoprolol, okay? And then we have our calcium channel blockers. They usually end in -pene. And then our ARBs, which end in the suffix sartan, and our ACE inhibitors, which end in the suffix -pril. Perhaps you have given or administered these medications in your past clinical experiences. Obesity also can affect blood pressure, and then there is a normal variation throughout the day. Throughout the day, at different times of the day, our blood pressures change. And certainly with disease processes, well, you can have disease processes affect our blood pressure, most definitely. A certain amount of pressure is necessary to, you can fill this in, maintain open vessels. Okay, that's the last thing we need is our blood vessels to collapse. In fact, that is the definition of shock, which we will be studying this semester. Shock is circulatory collapse. So again, we need a certain amount of pressure to maintain open vessels, for capillary perfusion, and for oxygenation of all body tissues. So let's talk about what regulates blood pressure. This is like a review of your physiology, which you should have had at one point or another in your prereqs perhaps. So this is a good review. Well, the answer to that is the sympathetic and parasympathetic nervous systems are the primary mechanisms that regulate blood pressure. Stimulation of the sympathetic nervous system exerts a major effect on peripheral resistance by causing vasoconstriction of the arterioles, thereby increasing blood pressure. The parasympathetic stimulation causes vasodilation of the arterioles, thereby lowering blood pressure. So, stimulation of the sympathetic nervous system, as you see on the top part here, it leads to an increase in heart rate. It also leads to an increase in the speed of the conduction through the AV node. Remember yesterday we talked about the AV node being like a little relay station that slows down the electrical conduction through the heart. And stimulation of the sympathetic nervous system also increases the force of contraction. Okay. And just the opposite occurs when the parasympathetic nervous system is stimulated. Stimulation of the parasympathetic nervous system leads to a slowing of the heart rate. It also leads to vasodilation of arterioles, lowering the blood pressure. And again, there's a little added thing there about the fact that it will actually cause vasoconstriction of the coronary arteries. So that's a little different there. Okay, let's talk about the fact that all of the blood vessels throughout our body contain both alpha and beta receptors. Okay, and as we said earlier, this is just simply a diagram to show you the normal vascular tone and then the difference, what occurs when we have vasoconstriction and vasodilation. Well, it is stimulation of the alpha receptors in the blood vessels that causes vasoconstriction. And you see in the bottom there, that is a narrowing of the lumen. And when we have the beta receptor stimulated in the blood vessel walls, it leads to vasodilation, as we see in the upper picture, with a lumen diameter that is increasing. Again, remember, the vasodilation will result in lower blood pressures, and vasoconstriction will result in increasing pressures. When alpha receptors are stimulated, the smooth muscle associated with them contracts. This contraction may result in an increase in blood pressure due to constriction of peripheral blood vessels. Now, that action may be useful in the treatment of patients with severe hypotension. Okay. So we do have medications that act in this way. And I want to give you an example of one such medication that is used and has this mechanism of action. And it causes the, well, let's talk about patients who have nasal congestion. Of course, you know that we would like to relieve nasal congestion, but when they have nasal congestion, we can use drugs such as Sudafed. This is an example. Also, another one would be neosynephrine. These nasal decongestants act by constricting the nasal blood vessels, and thereby it's useful in relieving the nasal congestion. And the mechanism is what you see here in the picture. Sometimes a stimulant of alpha-1 adrenergic receptors, such as epinephrine, may be injected into a parenteral injection site with another drug, like a local anesthetic, to constrict blood vessels within the area and prevent rapid diffusion of the drug away from the injection site. So we have various drugs that we can use, and their mechanism of action is just this, that they stimulate the alpha-1 adrenergic receptors that are in the blood vessels. Now, we said the stimulation of the beta receptors causes the vascular smooth muscle to relax, and therefore we have dilation of the lumen, right? Beta-2 adrenergic receptors are located primarily in bronchial smooth muscle and in the walls of blood vessels located in skeletal muscles, the brain, and the heart. We frequently will say that beta receptors, beta-1, are located in the heart, and beta-2 are located in the lungs. And we remember that because we have one heart and two lungs. Okay? Stimulation of the beta-2 receptors in bronchial muscle results in muscle relaxation, thereby increasing the diameter of the air channels and pathways and promoting improved gas exchange. An example of that would be the medication theophylline. Okay, it's a bronchodilator, and this is the mechanism of action for promoting improved gas exchange. Beta-2 stimulants or beta-2 agonists are sometimes used to treat bronchial asthma or other conditions marked by breathing difficulty. So you could fill in that blank on the slide that beta-2 stimulants are used to treat asthma. Beta-1 receptors are located primarily in the muscles of the heart. Stimulation of these receptors in the heart produces a more rapid heart rate, as well as a more forceful heart muscle contractions. Drugs that stimulate beta-1 receptors may therefore be useful in the treatment of clients with depressed cardiac function. When the beta-1 receptors are stimulated by adrenergic drugs, they produce increased contractility, and we refer to that as a positive inotropic effect. And I'll spell that word inotropic for you. I-N-O-T-R-O-P-I-C. It also, when the beta-1 receptors are stimulated by adrenergic drugs, they produce increased heart rate. And that is also referred to as a positive chronotropic effect. And I'll spell the word chronotropic for you. C-H-R-O-N-O-T-R-O-P-I-C. That's a positive chronotropic effect, causes an increase in heart rate. Of course, in the very bottom of the slide, you'll see a problem here, that you can have too much stimulation of these beta-1 receptors in the heart. Okay, excessive stimulation leads to arrhythmias. Okay. Okay, baroreceptors and chemoreceptors are located in the aortic arch, the carotid sinuses, and other large vessels, okay, that are sensitive to pressure and chemical changes and cause reflex sympathetic stimulation, resulting in vasoconstriction, increased heart rate, and increased blood pressure. So say that there is a decrease in cardiac output. Decreased cardiac output will initially stimulate the aortic baroreceptors, which in turn stimulate the sympathetic nervous system. The sympathetic nervous system, as we just previously saw, produces both cardiac and vascular responses through the release of norepinephrine. Norepinephrine increases heart rate and contractility by stimulating those cardiac beta receptors. And so cardiac output will improve with increases in heart rate and stroke volume. Norepinephrine also causes arterial and venous vasoconstriction, increasing venous return to the heart. Increased venous return increases ventricular filling and myocardial stretch, and increases the force of the contraction. Remember Starling's law. By increasing the stretch, you'll increase the force of the contraction. And also remember what that term we use for when there is increased venous return, which increases right-sided ventricular filling. That is another way of saying increasing the preload. So those baroreceptors are responsible for detecting differences in arterial pressure. When those baroreceptors are sensitive to changes in arterial pressure, when a person's blood pressure or arterial pressure increases, the response is going to be to slow the heart rate and to cause vasodilation. That is how you bring down the blood pressure. We also have them, they're sensitive to changes in blood pressure. So when a person's blood pressure decreases, they're going to sense that and respond by increasing the heart rate and causing vasoconstriction, thereby increasing that person's blood pressure. Now, this is a dynamic process. This is happening 24/7, all day long. your body is regulating your blood pressure to keep it stable. Okay, but the changes that are occurring are only temporary. So they're continually monitoring blood pressure changes.